Thank you everybody for joining the webinar. We are 1 minute after the hour, so we will get started. My name is Jonathan Pearlstein and I'll be your host today. I lead enterprise marketing at Virta Health. Before we dive into the webinar itself, let's go through just a couple quick housekeeping items. This webinar will be recorded. We'll send everyone who registered a link after the webinar is complete. There will be time for Q&A at the end of the webinar, so feel free to type your questions into the Q&A at any time, and we will get to them at the end. And then all participants at this time and throughout the webinar will be on mute. So again, if you have questions, you just can type it into the panel. So again, thank you everybody for joining today. Our webinar hosted by Virta Health on our National Diabetes Reversal Survey that we ran in partnership with dQ&A. And let me begin by introducing our panelists. And in addition to myself, we have Kelly Close, Rich Wood, Dr. Abbie Davis, and not shown here, Jackie Tait. So let me walk through each of their bios before we get to the business at hand. So first off, Kelly Close is an American writer, speaker, and advocate for people with diabetes. She is the founder and chair of the board of the Diatribe Foundation and also president and founder of Close Concerns. Prior to starting Close Concerns, she worked in the financial sector, writing about medical technology companies and also at McKinsey. She is viewed as an expert on diabetes and obesity and is a frequent speaker on the public health implications of diabetes and obesity. So thank you, Kelly, for joining us. Excited to have you here today. Next, we have Richard Wood, the CEO of dQ&A, the diabetes research company. dQ&A is a social enterprise that's committed to making life better for people with diabetes. Richard founded dQ&A with Kelly Close in 2009. He was previously president of the Consumer Insights at Nielsen, where he directed consumer market research programs. And Richard has a 20-year career in consumer and industry research, mobile applications, and as a technology journalist. Jackie Tait, who unfortunately we didn't get her photo up here in time, is a senior analyst at dQ&A and was the key contributor and architect of the analysis of this survey that we ran, the first National Diabetes Reversal Survey. And then finally, I'm excited, perhaps most of all, for Dr. Abbie Davis, who is a Virta patient and has been with Virta for 12 months and will be sharing her story on diabetes reversal. Dr. Davis works in higher education in Daytona Beach. So thank you, everybody, and a special thanks to all of our panelists for joining today. So let me provide a little bit of context. So I'm going to spend the first few minutes just providing a little bit of context about why we ran the survey and some of the goals of the survey, as well as just some general context on diabetes reversal and remission in general. We'll walk through the survey results, and then we'll have some time for discussion at the end. So context about the survey, it really stems from these two key statements here on this slide, which is on the one hand, we're seeing really rapidly growing awareness and excitement around diabetes reversal and remission in the scientific community with diabetes researchers and experts. And this is most and perhaps best exemplified by a recent study by the American Diabetes Association on a consensus report on type 2 diabetes reversal and remission. And I'll talk about more about that in a second. But what we wanted to explore with this survey is, while there's so much excitement going on in the academic and scientific spheres around reversal, what do people living with type 2 diabetes actually think and know about reversal today? And so that was really the goal of this survey. And we were able to get responses from over 1,000 people living across the United States and living with type 2 diabetes. But before I get into the survey itself, let's double click onto each of these statements here just to provide a little bit of background so we all have the same context around where we are with reversal and remission today. And I want to begin with the report I referenced from the American Diabetes Association that was a really groundbreaking international consensus about type 2 diabetes reversal and remission. So this was just published in August of last year. And some of the key aspects of the report are listed here on the slide, where first, the term diabetes reversal was listed as an accepted term to describe the process of returning glucose levels below those that are diagnostic of type 2 diabetes. The report also emphasized that diabetes reversal can be sustained and can persist over time with the withdrawal of glucose-lowering diabetes drugs. And they also defined a term called diabetes remission, which was really meant to be defined as having a blood glucose below the diabetes threshold that persists for 3 months in the absence of blood glucose lowering drugs. So this is a really big deal, especially for us here at Virta Health. We are a company founded on the mission to reverse type 2 diabetes in 100 million people by 2025. And we've been talking about diabetes reversal and remission for a long time. And so to have the leading experts in the world on type 2 diabetes come together and say, this is a topic that merits further exploration, merits further definition, was a big deal for us and a big deal for people all over the world who live with type 2 diabetes. So this is what's happening on the research and scientific side. But before we get to the survey, I want to make sure everybody has the same context about living with type 2 diabetes, trying to manage it through our current standard of care, and how that's so different from the experience of actually reversing type 2 diabetes. And so let me illustrate it through this chart over this slide and the next, where we'll follow an example patient journey of somebody living with type 2 diabetes over a decade. And what we're going to follow is this red line, which illustrates a patient's A1C. And this may be elementary for some people on the call, but I just want to make sure we all have the same basic understanding. A1C is a measure of blood glucose. Reading above 5.7 and below 6.5 is considered to be in the pre-diabetic range. Above 6.5 is considered to be diagnostic of having type 2 diabetes. And typically a reading above 8 is considered to have uncontrolled type 2 diabetes. And that's where a lot of the very major health problems set in, where diabetes can affect your liver, your heart, your kidneys, your eyesight, et cetera, et cetera. And so it's very important with our current standard of care to bring A1C, to bring the blood sugar under control. And the primary way that we do this today with standard of care is through diabetes blood sugar lowering drugs. And so we begin with the lowest cost, least invasive drug, which is metformin. And over time, when that stops working, patients then are graduated to the next tier of drugs, which are branded orals, which are more expensive and can be more effective. And then after that, they move to branded injectables and ultimately to insulin. So this is an all too common story that plays out over years and decades. And you can see why, looking at this, patients are often told that type 2 diabetes is a chronic progressive disease and is in effect a life sentence. People view it as something that you get and you're going to get for the rest of your life. You're going to have it for the rest of your life. So you can understand how scary it is to be diagnosed with diabetes and all the various complications and costs that are associated with it over years and decades. Now, I want to contrast that with the experience of diabetes reversal. And let me show you that in this chart. And so we've compressed the timeline from years now to weeks. So this is looking at less than a year to effectively half a year. And we see that in a matter of weeks, through diabetes reversal treatment, patients are able to lower their blood sugar below the diabetes threshold, oftentimes below the pre-diabetes threshold, and do it not just without the use of pharmacotherapy, but while safely eliminating and having their drugs deprescribed by physicians. And this is something we see all the time here with our patients at Virta, and is really the promise of diabetes reversal. So this was a little abstract, just want to put a human face on it. And we're going to talk to Dr. Abbie Davis at the end of this call to get even more of the lived experience of type 2 diabetes, living with it and the reversal process. But I want to share just one quick story from one of my personal favorite patients who I've met multiple times here at Virta. His name is Kevin. He's a patient that has got access to the Virta treatment through our relationship with the employer US Foods. And Kevin, when he tells me about his story living with type 2 diabetes, he speaks with a lot of fear about the day that he learned he had type 2 diabetes for the first time. He describes it, in fact, as one of the worst days of his life. He was afraid for this lifelong sentence. He was afraid of the costs associated with the drugs, and he was afraid of literally would he see his kids grow up. Type 2 diabetes felt like a heavy weight on his shoulders. And over the course of time, some of his fears came true. He spent over $6,000 per year out of pocket on type 2 diabetes medications. That was a very significant expense. And he had all sorts of other side effects and complications associated with it. But fast forward to when he learned about Virta, when he learned about diabetes reversal, and ultimately he was successful in reversing his diabetes with Virta. And now he describes the day he learned that he reversed his type 2 diabetes was the best day of his life. So contrast that. Diabetes being the day he learned he had it was the best day, and the day he reversed was, the day he learned he had it was the worst, and the day he reversed it was the best. So that just shows you some of the highs and lows people can experience around this very significant disease. Okay. So I've hinted at this earlier about what is Virta, and then we're going to get on quickly into the survey itself. As I mentioned before, our mission is to reverse type 2 diabetes in 100 million people. We're the leading organization in the country, and I think the world, that is reversing type 2 diabetes today. We do it through a combination of a nutritional therapy based on carbohydrate restriction in combination with our own fully virtual provider-led medical practice. And we have a very unique fee model that's highly value-based, and we put 100% of our year one fees at risk. So that's a little bit about Virta, but let's dive into one more slide of context, and then we'll get into the survey. And so not everybody's aware of this, but there's actually 3 proven methodologies in the peer-reviewed evidence for reversing type 2 diabetes. Virta's approach is one, which I'll talk about in a second, but 2 others that we explored in this survey one is bariatric surgery. So that's been shown in clinical research to be effective in reversing type 2 diabetes. The second is a very low calorie diet. We'll talk a little bit more about that and the specifics around that. But in essence, patients were given an 800 calorie per day diet. So very, very low calorie diet. And that has been shown some efficacy in reversing type 2 diabetes. And then the third is what we teach here at Virta, which is a very low carbohydrate diet. And there's a great deal of evidence that this can be effective in reversing type 2 diabetes and putting into remission. And we've published that, have over 8 peer-reviewed publications to date, and have been included in the American Diabetes Association's standards of care. So in our survey, we sought to explore general opinions about and attitudes towards diabetes reversal, as well as attitudes towards these 3 specific methodologies. And so now let me turn it over to Jackie Tait from dQ&A, who will provide a little bit more context on the survey itself. Jackie?
Hi, everyone. Yes, so Virta and dQ&A partnered up to conduct this study from November 30th to December 2nd of 2021. And the survey was administered using an online email-based platform, and respondents were paid an honorarium for fully completing the survey. I would also like to note that the data was weighted to match the profile of the type 2 diabetes population. This was according to CDC benchmarks, and specifically was weighted around insulin therapy. And this weighting resulted in an overall effective base of 1,024, which you'll see in the analysis. And throughout the survey, our questions focused on 3 key themes, beginning with gauging overall awareness of reversal, investigating attitudes towards the 3 methods of reversal, and finally asking about motivations around reversal.
Excellent. Thank you so much, Jackie. And Jackie will be around for the Q&A section at the end of this call. So if there are any detailed questions, I'd love for you to help out with that. But thank you so much for your partnership on this survey. It's been great. All right, so let's dive into the agenda, for the remaining agenda for today. So we'll walk through the survey findings. And as Jackie said, there are 3 key categories: the awareness around reversal and remission, the attitudes towards the 3 methods, and then motivation, what gets people excited about reversal. We'll walk through some implications for employers and health plans. I know many of you are on the call right now. So what's the so what for the people who have ownership of over the health of a population? And then we'll have our discussion between Abbie Davis, Dr. Abbie Davis, and Kelly Close. Okay, so let's dive in to the survey results, and we'll begin with awareness of reversal. And we asked the question just right off the bat of to really get at, like, is this real, or do you think this is snake oil kind of thing? And so we asked the respondents, do you believe it is possible for you to reverse your type 2 diabetes? So this is not some abstract concept, but this is something that is real for you. And what you see here in the pie chart on the left is that 41% of the respondents say yes, it is possible. But an even larger percent, 47%, said, well, I'm not so sure. And so I think this uncertainty around type 2 diabetes reversal is the key theme we'll continue to explore over the coming slides. But we actually double clicked on these people who said, yes, I believe it's possible. And we said, well, if you think it's possible, how likely are you to make it a personal goal for yourself? And that was a really startling finding. We saw of these people who thought it was possible, 96% said they're either likely or definitely likely to make reversing type 2 diabetes a goal. So there's a lot of interest in this. And just to give a little bit more context about the flow of the survey, at this point, we had given the respondents very little information about diabetes reversal or the 3 methods. They know nothing. We just are introducing these concepts and trying to get a sense for their awareness and interest. Okay, second slide here is a more detailed view on awareness of reversal. And I'm going to break down this pie chart on the left for you in a minute. I know there's a lot of slices, but let me walk you through it. And so we're going to read it starting from the 32% chunk. We asked people, how aware are you of diabetes reversal? And we gave them a lot of options, ranging from not at all aware, and we're going to go counterclockwise around the circle range, which is going to go from not at all to somewhat to very aware. So 32% said not at all aware, never heard of it. 46% said, I heard of it, but I know little to nothing about it. And so let me just pause there for a second. The 78% of the population knows little to nothing about type 2 diabetes reversal. So that's a pretty large chunk that know nothing. So I think that's the key theme that we'll keep coming back to, that there's a huge knowledge gap that we need to close between the experts, the scientists, and the general population of people living with type 2 about just awareness that this is an option. Okay, now we'll keep moving counterclockwise. The people who've heard of it but know a lot about it, only 6%. People who've actually discussed it with their healthcare provider, 4%, and then 12% people are actually trying to do it today. So if we add all these 3 wedges up, that's 22% of people that I would consider to be very familiar with reversal. So let's double click under this 12% wedge. Among that 12%, we asked them, okay, so you say you're doing it today, how are you doing it? And really interesting here that 88% say they're using diet, which is, as we saw before, one of the 3 or 2 of the 3 main evidence-based approaches to reversing type 2 diabetes is through diet. So that's great. The next one on the list of things that are evidence-based is bariatric surgery. Only 3% of the respondents are using bariatric surgery. And then everything else in here are kind of in the realm of tactics that are indirectly related to or not, I guess I would say not as evidence-based in terms of their efficacy in reversing type 2 diabetes. So I think what this illustrates to me is that even among the people who we say, like, oh, they're trying to do it, I know about it and I want to reverse it, there's a lack of information about what are the right methodologies that are evidence-based for reversing diabetes. So that's an interesting insight for me. Okay, we had a demographic cut on our survey, and we're able to look at some race and ethnicities and do some slices of the responses by race and ethnicity, looking at Hispanic, white, and Black or African-American populations. And one thing that was interesting here is that the percentage of people across all 3 that were very aware was about the same. So the very aware group is sort of unchanged regardless of demographic, hovering around 20 to 22%. But the percentage of each group that is not at all aware is actually highest with the Black or the African American group. And so I think what that illustrates is that there is a health equity angle here with diabetes reversal, and that we need to, as at Virta, and I think as medical and healthcare leaders, need to do have some work to do when it comes to closing this health disparity around knowledge that diabetes reversal is an option. Okay, next question. We asked about what are the perceived barriers to reversing type 2 diabetes? And again, I want to emphasize that at this point in the survey, we had not yet introduced the 3 evidence-based methods to reverse type 2 diabetes. We just tried to get a sense of like, why aren't you reversing your diabetes today? And perhaps unsurprisingly, lack of information or just don't know enough was the biggest obstacle. So again, coming back to this theme that there's just this huge knowledge gap when it comes to diabetes reversal, and that's the biggest opportunity. Aside from that, there were concerns that maybe it would not be sustainable, maybe it takes too much effort, and maybe it's too expensive. But again, here there's just I'd say very low understanding or literacy when it comes to what are the actual methods that work to reversing diabetes. Okay, so of course that tees up the next section where we'll actually introduce the 3 methods, the evidence-based methods for reversing diabetes, to the survey respondents and get a sense for what they think about each method. And so we gave them a description of each one. So method 1, bariatric surgery, weight loss surgery. And we presented the survey respondents with the clinical evidence and what has been shown around the efficacy of weight loss surgery when it comes to diabetes reversal and remission. So you can read that here if you like. Did the same with the very low calorie diet. As I mentioned before, it is a very low calorie diet, 850 calories per day for 2 to 8 weeks, compared to, I was reading recently that typical Americans actually eat about 3,600 calories per day. So about 75% reduction in calorie intake. But there's some very compelling evidence here that this works in achieving diabetes reversal and remission. And then of course, the very low carbohydrate diet. This is the area in which Virta has been a pioneer in clinical research. We have a 5-year clinical trial running in partnership with Indiana University. We have over 8 peer-reviewed publications on the efficacy of very low carbohydrate diet in reversing type 2 diabetes and achieving remission. And we presented a description of this path and this methodology as well. And so, of course, the first question that we asked is like, okay, here are the 3 ways that you can do it. Which, how attractive is each of these to you? How appealing? And so here are the results from that question. So we let them rank the level of how appealing they thought each method was, ranging from very unappealing through very appealing. And what we found is that the low carbohydrate had the highest levels, highest ratings of appealing from the respondents. And so 56%, if you combine somewhat and very appealing, said that the low carbohydrate approach was appealing. It was the only approach where more respondents rated it as appealing compared to unappealing. If we look at the very low calorie option, 35% said that was appealing, and then the weight loss surgery, 14% said that was appealing, and actually 69% rated the weight loss surgery as very unappealing. Okay, so we actually double-clicked into all their responses and allowed them to provide free-form comments to describe why. Why do you find this method appealing? What are the benefits and drawbacks? And so we can walk through each one. So for the very low carbohydrate diet, what respondents liked, and these were free-form comments that Jackie and the dQ&A team actually coded. And so for the very low carbohydrate diet, the perceived benefits were that it was easy, it seemed doable. Some people had already begun to adopt low carbohydrate eating habits, I think showing that this is a phenomenon you're seeing in grocery stores and in in American eating habits already taking place today. And people like that it seemed effective. The drawback, as you can imagine, there's some people who don't want to give up carbs, and there's some people who were concerned about the sustainability, again, of giving up or significantly reducing carbohydrate intake. For the very low calorie diet, what people liked is some people thought it seemed easy. People thought they liked it seemed effective, and thought it seemed uninvasive, especially relative to the weight loss surgery. The drawbacks here were a lot of comments that it was extreme or unsustainable, and then a lot of people just afraid that maybe this seems unhealthy. So that was really interesting. For the weight loss surgery, what people liked about it was that it was fast, a great way to lose weight, that it could control their appetite, but very consistent feedback here was that it seemed extreme and people don't want to do surgery and they're worried about the risks associated with surgery. Okay, just one more slide on the survey results, and then after this, we're going to get into implications for employers and payers. So the last category of the survey, the last section, looked into why do you want to reverse, so what's motivating you, and we had a lot of free form responses here that I think highlight some of the human rationale, human drivers for wanting to reverse diabetes. And again, these are people who may not have ever heard of reversing diabetes or remission of diabetes before this survey. So people talked about living without fear, especially of high or low blood sugar, which is a daily fear people experience, especially those who are on insulin. People just not wanting to inject themselves with insulin or other injectable drugs or take pills. People who love the idea of having less health risk associated with all the complications associated with diabetes around the kidneys, heart, eyes, other organs. People talking about the hopes and potential around reducing their costs. And we talked about that earlier with Kevin, that this diabetes is an incredibly expensive condition to live with. And so that was a key hope. No more insulin, and people just feeling freedom. They don't have the weight of diabetes on their shoulders every day. And then there's sort of the mental health aspect to this as well, where people literally would say that they want to get rid of their diabetes because they think it would help them feel better about themselves and their self-identity. All right. So those are some of the key highlights from the survey. And we can dig into it in a bit more detail in the Q&A section. What I want to leave people with today before I turn it over to Abbie and Kelly are just a few implications for some of the population health leaders, employers, and health plans that we have on the call today. So first, the most obvious opportunity is to educate people about type 2 diabetes reversal. There's this huge gap that scientists, experts know about it, they're talking about it, they're researching it, but that the lay people who actually live with type 2 diabetes don't even know about it. And that the key factor that would influence their decision to go after this as a goal is just knowing more. And so that's just that's low-hanging fruit, is to take advantage of this information gap and to try to educate people about diabetes reversal. Because as we saw from the survey, and this is just summarizing some data that we looked at already, 78% of people living with type 2 diabetes are either completely unaware of it or know just a tiny little bit about it. But once they do know about it, once you do tell them that reversal is possible, is an option, and even if you tell them about the methodologies and how hard they are or whatever, still 87% after learning it's an option say they want to make it a personal goal. And you see the experience on the bottom of the slide of what we hear time and time again from some of our patients, like literally in tears, speaking to a Virta enrollment advisor as they're learning for the first time that reversal is possible. They had no idea it was even possible. And so that's just a huge, huge opportunity if you are a health plan or employer leader here. The second thing, one step further beyond just education, is to actually make reversal available as an option. And so I know today there's many other diabetes solutions that people have already deployed on the market, both at health plans and employers, in particular diabetes management solutions. And I would challenge an employer or health plan to not have the mentality that like, oh, we've checked the box in diabetes, because I would challenge you to think about your population in a more detailed manner, because you can think of your population as falling into three segments. There's people who are satisfied with the traditional care model, and maybe they're completely disengaged, maybe they're engaged, but they're not going to do any new diabetes program you give to them. They're not going to engage with anything new. They're happy talking to their PCP or their endocrinologist, and that's enough. In the middle bucket, you have people who are willing to adopt new models, new technologies, and want more help. And for those people, maybe diabetes management solution is fine. Something that allows them to do more education, more self-monitoring. But there's this whole third group of people who are motivated to reverse type 2 diabetes. And for them, offering a diabetes reversal solution is the best approach, is the right approach, is the moral approach, in my point of view. And as we discussed on the previous slide, this group is bigger than you think. 87% of people, once they find out it's possible. And so that's, of course, what we do here at Virta. We're the leading company in the US and the world that is delivering type 2 diabetes reversal. We do it through a combination of a low carbohydrate nutrition therapy combined with an advanced telehealth model where we employ our own physicians, health coaches, and we conduct remote monitoring of patients on a regular basis and are safely de-prescribing them from their medications as their blood glucose is coming down through our nutritional therapy. By the way, we don't just do it for diabetes, we do it for prediabetes and obesity as well, which collectively are metabolic health conditions that are experienced by 60% of a typical employer or health plan population. We do have a diabetes management solution for people who may not be ready to reverse yet. But what's unique about our diabetes management solutions is that we give patients a soft on-ramp into reversal when they're ready. And we've reached very significant scale over the last few years. I joined Virta about 3.5 years ago. I think we had maybe 10 customers, and now we have over 200 today, including over 20 or 25 large health plan partnerships on the fully insured, ASO, even the Medicare Advantage and Medicaid lines of business. We serve all different population segments, and so we're delivering this diabetes reversal results across all types of populations. So I'm going to end my section here and welcome Kelly Close and Abbie Davis to join and have a discussion about the patient experience around living with type 2 diabetes and reversing type 2 diabetes. So I'll turn it over to you, Kelly. Thank you.
Oh, amazing. Thank you so much, Jonathan. That's so great. And what an honor for me to get to be here with Dr. Abbie Davis. I have a lot of questions for you, Abbie, as another person with diabetes. You've been so inspiring to me. I've gotten to watch Virta for a super long time at Close Concerns. That's what we do, try to make people working around diabetes and people with diabetes through diatribe.org smarter. So your story is amazing to me. So just maybe can you just start out and talk to us about how you heard about Virta in the first place?
Well, I actually heard about Virta through my healthcare provider. They gave me a call and said that they were sampling some folks to try this reversal of diabetes and if I would be interested in it. And at that time in my life, I was very grieved, depressed, stressed, and I was looking for an outlet. And I had started counseling. And so I was trying to get help any way that I could. So I said, sure, why not? So once I did that, my life just took a turn for the better, and it continues to get better.
Yeah, I love hearing that. And thank you so much for that. Just how you were acknowledging right there about grief, grief, I've had a lot of grief too. It kind of comes and goes, doesn't it? And being so open about like mental health and how we think about that is really cool. So thank you for that. Can you talk also about like, what was your management like? Were you taking meds? How were you approaching food, stuff like that?
Well, again, through the grief process and the depression, I really wasn't managing, food was my go-to. That satisfied me. I just get whatever I want to eat, and that was it. And because of it being high carbs that I would indulge in, it really wasn't good for my health. Back to the grief part, when I decided to agree to do this and to live and stop just existing, I lost my mother. My family, in fact, my whole family except one sibling, all had diabetes. And I lost my mother, my older sister, and my brother to diabetes-related diseases all within 6 months. And so that made me think about me doing something about it. I did not, and I was blessed that I did not have the side effects that they had. Losing limbs, the strokes and the heart attacks. And I didn't have side effects like that. So which I blessed that I didn't have it, but it was scary because I wasn't doing anything at that time about the diabetes. My attitude was, it wasn't affecting me. So, it's not all what it's cracked out to be. But eventually it was surely, breaking down my body. So I decided, yes, I better take this serious and do something about it. And Virta found me, and I'm like truly excited I'm still excited as if it was the first day, to partake in this program, because like I said, now I'm living and not just existing.
Oh, I know, completely. Yeah. And everybody, Dr. Abbie, she said, I can call her Dr. Abbie, Dr. Davis. Dr. Abbie was talking to everybody in our office here. And I was like, oh my gosh, like, come over here. This is so inspiring. Because like, you're the idea of like proactive. This is proactive health. And what's the name of your health plan again? Is it Florida?
Florida Healthcare Plan.
So how did that work? Like literally they called you and you picked up the phone and then.
Yeah, they called, I picked up, and they gave me, a yes or no, so they can start the process. And once they called, I said yes, and Virta was in contact with me. I went through a series of, had to give my test, my blood test results, series of counseling, questions, telling me about the program, introduced to my health coach, which I love data.
Who's your health coach? Oh, well, yeah, wait, okay, say more about that.
And so, but she's the best because, it's one thing, people think that diabetes, that is food that affects it, that is weight that affects it. But I've learned so much that how to control even my stress levels, that affects my diabetes big time. And I didn't know that at that moment. And that it's not just food, because as I stick to the low carb, that's what, dropped my numbers. And I know that it's not the food, but then I had to look at my whole self. What I was going through at the time. And I had started a new job. It was a little hectic for me. COVID, all of this stuff was, just totally out of control. So with my health coach, she teaches me to look at other things that are going on in my life that could affect my blood glucose numbers and address those. And one biggie was dehydration. We never think about, being dehydrated, not drinking enough water. And so we just picked through different things. She asked questions. And I'm, well, no, I'm not drinking enough. Well, let's try drinking 64 ounces, and see if that, and it does. It actually changed my numbers. Like within 24 hours, I was, my numbers dropped.
Right there. And I just want to hop in and say, like, that was so specific, some of this learning from your coach. You said like you could even text her at night and stuff like that. How'd that work in the Virta Health Clinic?
It was just funny because as I was prepping for this, she gave me she sent me a text of encouragement. She's very good at encouraging me and trying to use the resources that Virta provides for us, to get those numbers, good numbers, and get those, healthy bios, from eating to meditation to self-evaluation. There's just so many different recipes that they have. What should I eat or what shouldn't I eat? What foods have a lot of carbs and what foods aren't, and it's a great, it's great. It is really making a change in my life, and not only in my life. My sister and my coworkers are now on Virta, and they're progressing.
Oh my God, are you serious? That's so cool.
Yeah.
I just want to go back to that thing that you were saying about encouragement. Like, that's so foundational, isn't it?
Yes. I'm a big cheerleader for motivation. I love to, even when I'm teaching in my class, I think that when you motivate people and let them know what they possess inside. Everybody possess goodness. I don't care what any, social medias or whatever thing says, but we all have that goodness within us. And when we have someone to bring that out, so that we can be able to make ourselves better and see the goodness in ourselves, and then we'll be able to share and live a happier life, so that's what I get a lot from my health coach.
Well, and you're so modest. You were talking before about about how you were doing a few different things. You were also studying for your doctorate at that time, working, all of that stuff, and it sounds like you could kind of get in touch with your coach anytime, which is pretty cool. And at that time, like in the beginning, you were taking other medicine too, so that was all the stuff that you had to remember, or how did that work?
I did. At that time, that when I first started Virta, I was seeking my doctorate degree. I was the primary caregiver of my 92-year-old mother. Was in a job that I hated. And I was just having such a tough time, after the deaths in my family. I was having such a tough time of getting myself together. So I just literally talked to my health coach about what was going on in my life, and not like some people don't want to get personal, but with me personally, it was an outlet for me to be able to accomplish what I needed to accomplish, what I worked so hard for. And it took me it took me 10 years working on my doctoral degree, and they were ready to kick me out of school.
No,
and just sitting there talking with, texting with Dana and her, encouraging me, letting me know I can do it, helping me set up a plan to conquer each assignment. That was, you would think that's outside of Virta, but actually it helped me mentally to be able to accomplish those goals and to, carry on. So I always say that Virta not only ministers to the physical body and your health, but also the mental and the spiritual, be it,
body, mind, mind, spirit.
Body, mind, and spirit.
Body, mind, spirit. And so then it sounds like you were taking like glipizide and you were taking insulin, and then you even got to go off of those medicines. The way
I was actually
in a different way. People with diabetes, we don't think about that. So tell us about that part.
I lost 40 pounds. once those pounds begin to drop, and they're still dropping,
40 pounds. Is that, wait,
40
hold on. 40 pounds. Wow.
Yes.
And I got another question about like what the hard parts were, but keep going. I mean, that must have been like, that just felt like victory when you got to go off some medicine.
Yeah, I was on 2 insulins, metformin and glipizide, cholesterol, high blood pressure meds, all of that due to diabetes. Once I started with Virta and using the eating plan that I had, I'm off of the insulin, both of the insulins, off of the glipizide, and the only thing that I'm currently on now is the metformin, and that's my goal, is to be off of that by the end of this week.
Because it's that, and that's truly a reversal. And you would be off of that. And I was curious about, like, can you say, and health plans, I mean, I don't know if you heard that part about, like she got to talk to Dana about how she felt. Like there's time that she has. Somebody's asking her and listening to her, and diabetes can be super isolating. But tell us, like, what about the hard parts, or what about like understanding the risks? There's a question out here about that. Tell us about that part, the carb stuff in the beginning. Was that harder?
It wasn't hard for me. Again, I live alone. So once I started Virta, I completely emptied my house of anything that was heavy in carbs, completely emptied it out. And I did a little, and that might not be for everybody, but for me, I went shopping. I took a picture of all the foods that was given on my list of what I could have, and sent it to Dana and for her to review it. And that,
keep going.
No, once I got it in the house, that if it wasn't,
cool.
What I'm eating in the house, I wasn't eating it at all. So it wasn't hard for me to change. And then again, it's giving up a lot of carbs, because you got your vegetables, your good green leafy vegetables. And then when you have your meats, and that kind of helps satisfy me.
Oh my God, you guys! I mean, this is inspiration. What and I'm trying to do that stuff too. Like if you're at night, if you're eating carbs, if you try to get them out of the house, it is so much better. You miss them, but if you don't have a choice, that's pretty cool. So you're inspiring me big time. I wonder if you could say, like, what's the single most important thing that you would want to say to health plans, for example?
The single most important thing, before I started Virta, I was seeing my doctor at least 6 to 8 times a year. Once I got Virta and put it in plan, twice a year do I see him. So that's a huge difference right there. And then you got the cost of not taking those high price medications, those insulins, which is, paying for all of that, which is a good thing. So yes, it benefits, organizations and health plans.
Yeah, I got it. And, I think that, there are getting to be medicines that can even help us with our hearts and help us with kidneys. I think it's so interesting, like how all these things can also work together. But the fact that you got off the medications that are hard to take, those are also medications that can even cause hypoglycemia or weight gain. That is a serious inspiration. You think you're going to keep the weight off?
Oh yes, I'm still in the process of losing. Slowly but surely, it's coming off. So I'm gonna, I don't want to turn back. I want to live. Like I said, I want to live. I want to be more active. I've been more active. I've been actually that photo of that I had of that he showed was when I started doing 5Ks, doing more outdoor things, and so it just gives me the zeal, the excitement of just learning new things and traveling more. So, and being healthy with that. So yes.
Everyone, I give you Dr. Abbie Davis. Amazing. We're going to go back to Jonathan, and we're all going to get to hear even more from you. You got a lot of questions out there.
Okay.
Thank you, Abbie, so much. And thank you, Kelly. We want to use the last 8 or 9 minutes we have on our call for Q&A. So just a reminder, folks can put their questions into the Q&A, and it'll come to us, and I'll do my best to moderate. One of my favorite questions that came in is like, somebody said, "This is not a question, but I love the saying," this is for Abbie, "living, not just existing." So
Yeah.
this is a sort of a right on point there. So thank you, Abbie, for saying that. Okay, well, let me, and Richard and Jackie, some of the questions are for you, so feel free to come on camera and off mute when as you wish. I will take the first question, I suppose, which is somebody asked around, they say, we mentioned that 78% of people don't understand reversal. How does Virta educate people on the benefits as well as the risk? If you're an employer or a health plan, what do we provide? And so one of the core services that Virta provides is support for marketing and communications. We have a wonderful marketing and communications team. Abbie received a phone call. So we have as you can imagine, we have multi-channel approach to getting in touch with people, including sometimes phone, but often email, depending on the population. And we work closely with our partners and health plans and employers to determine the right mix of communication tactics. But we have a really solid playbook around, educating people around reversal is possible, reversal exists, here's what it is. And then as people enter our clinic, during the intake process, we educate them throughout that onboarding process as well. And Abbie, I don't know if you want to add anything here about what it was like for you to learn about Virta for the first time.
Just it was a prayer answered, a silent prayer answered. I wanted to get out of the situation that I was in, and I literally prayed, and they called, and I've been on this journey of just creating a new me, a better me, and I give thanks to Virta for that, so.
Great, wonderful. Okay, well, here's a question for Richard and Jackie. Just in terms of looking at the survey data, anything that stood out to you as especially interesting or exciting that may have planted a seed in your mind for future surveys in the future? We can do a little bit of work today at the end of this webinar, planning our next step. Any thoughts on things that could be further explored?
Well, yeah, and it's a great question. We have really been scratching the surface here, right? So we've identified, we managed to identify the degree of, if you like, awareness and interest in this process. I think there's a lot more, and Virta's doing this work as well. I mean, this wouldn't just come from us, but there's a lot more about what it's like to engage with this kind of program over time, and what it takes to keep the lights on as people are going through it. Both the personal relationship with a coach, but also the digital delivery of the service. So, the way to scale this, there's obviously lots of potential for digital health to enable a lot of this. And really, we're just fascinated by that particular part of it, the potential for really large scale application of this kind of approach and this kind of technology. And somebody asked me a question early on about folks on Medicare and availability of low carb foods and low carb diets generally. And it is, I did go and look it up, and it was kind of enlightening that folks with type 2 who are on Medicare, we asked people about their barriers to managing their diabetes effectively. And folks on Medicare are significantly more likely than any other group to say that not eating the right diet is their biggest barrier to managing their diabetes. So that was a great question. Thank you.
Great. And just to bring that back to the Virta clinic, we have patients on Medicare, Medicaid, living in food deserts, truck drivers who are eating at fast food restaurants much of the time, And part of what we do is to tailor the nutritional recommendations to meet each person where they are. And so we make it work for people, regardless of their situation, and try to meet I guess recognize the reality, and we've achieved really phenomenal results across all these different populations.
So Jonathan, I love that, and I that to me is just at the heart of like you guys are doing so much with a really wide range of people. I wonder what you think about, what the impact might be if there were more patients like Abbie.
In what way?
Well, we could start with like, I don't know, in the country, in the world, like, just it's this very different proactive kind of approach to health that I feel like must have all these other positive externalities, like she was talking about, kind of like mental well-being, et cetera.
Right. I mean, I think that's a really good question, because it's like sometimes people talk about diabetes as being this very narrow condition, but it is sort of at this intersection of all these other, this whole constellation of interrelated metabolic, heart health conditions. And so and mental health. And so we actually published some research earlier this year showing reduction in depression, rates of depression for people on the Virta treatment. You can imagine having type 2 diabetes is not good for your mental health. Similarly, a whole host of medical benefits to heart health, reductions in cardiovascular risk score, as well as liver health. And you talk about non-alcoholic fatty liver disease as one of the most expensive yet unknown diseases, and least talked about diseases in this country. There isn't a drug on the market for it today, and we've shown really promising results there for patients on Virta treatment. And so question is like, well, what happens if we achieve our mission at Virta and we do reverse type 2 diabetes in 100 million people? My hope would be, not only are we transforming these lives and taking so much money out of the system, but from a health equity perspective, diabetes disproportionately affects people with lower income and people of color. And so this is one of the best investments we can make as a society into health equity as well.
I know there's a question up here about CGM. Professional CGM, I guess, is actually anyone can use professional CGM. Is CGM part of what people ever use for checkups? Or if Abbie or Jonathan has any thoughts about that, that's from Elizabeth McAtee.
Yeah, I mean, we do have patients who use CGMs and share that information with us as part of the Virta treatment. It's not required. It's not a core part of the treatment, but there is a lot of excitement, I would say, in the industry today around CGMs, and so it's something that we're considering. But I'd say the core of our treatment does not require a CGM, and the vast majority of our patients are successful without one.
Just thinking, Abbie, you were talking last night about how it might be nice to be able to have it though every once in a while, like intermittent use, so you can see how you're doing and you can exactly see how Virta is working. And I don't know if you have thoughts about that, but that might be a way that people could even see if what they're doing is that the Virta Health Clinic is working, and it might reinforce the food and all that.
It's just like I said, my coworker has the CGM, and he had it. He had to qualify for it with the insurance to cover it because it can be expensive. But he was on insulin. I didn't qualify for it because I heard about CGM after I was taken off of the insulin. So I think that, which I don't care. I'll continue to poke myself to check my numbers, but it was extremely convenient for him because when he can just check his numbers all the time to see whether or not his blood glucose is up or down. And so I think that it would be a good idea if we could have be able to implement that within our program, so you can keep a better record of your blood glucose.
Yeah, I think people at dQ&A, thousands and thousands of people who have answered the surveys who have said how helpful that it can be and could really reinforce all the strengths of Virta. It's really cool also just to see all these people out there. Abbie, did it surprise you? I know we have 1 minute.
Yeah, I think we're at time.
Did it surprise you? Well, you can tell us later if it surprised you how many people still don't know about reversal. But wow, Virta, we just want as many people to know as possible. So thank you,
Exactly.
for having us.
Yeah, agreed. I mean, I just coming back to the survey and the key point that there is this huge knowledge gap around reversal, around the ways in which you can reverse type 2 diabetes. If we want to achieve our mission here at Virta, reversing type 2 diabetes in 100 million people, we need to close that knowledge gap, but we need help. So I thank everybody on this call, especially our panelists, Richard, Kelly, Jackie, and Abbie, for helping get the word out. And I am very grateful for everybody who attended. And as I said at the outset, we will send out the recording from this webinar to everyone who registered. But thank you everybody so much for your time, and we'll conclude there. So thank you.